Well, this has been great so far, guys. I want to get into some myths versus facts now. So every week on the show, we break down myths versus facts. I say a statement, and then my panel says either myth or fact. Will be kind of rapid going a little bit. But you'll say a statement. I'm sorry, you won't say a statement. I will say the statement. It's my show, gosh darn it. I'll say the statement, and then you guys basically say myth or fact, and gives a few sentences of why it's a myth or a fact. But again, we're talking about setting the record straight when it comes to your health, and this is some high yield stuff for you out there. But we want to talk about, when we're talking about brain tumors, we want to set the record straight. Your answer is not always on Dr. Google. We'd rather have you come in and see us and have us answer your questions. So here we go. Myth versus facts. Hashtag Cancer Sucks Series Part 1. All right, brain tumors. The first question here, or first statement, is for Dr. Schueler. Here we go. The statement. The doctors suspect I have the doctors suspect I have a tumor in the brain. This means I have brain cancer. Myth or fact?
That's a myth.
Please explain.
Well, yes, you could have a brain tumor, but it also could be, like I said, from the meninges was said earlier, so the coverings of your brain can have a tumor. Like I said, 95% of those are benign, so you not necessarily have cancer, you may have a tumor, which is a mass growing, and unfortunately in the brain, the one caveat is that it's inside your skull, so it growing, even though it may be not benign, can cause problems. So that's, it may not be malignant, but it's still a tumor. But yeah, it is a myth that it is cancer. We don't know that until we have a piece of it or what it looks like on the MRI.
Excellent, thank you. Here we go, Dr. Broderick, here we go. Here's a statement. Brain tumor is a long-term consequence of headaches.
That's a myth.
That's a myth, please explain.
So there are a lot of things that cause headaches. Everything from a beverage or two too many the night before, to dehydration, to there's
a million things, yeah. I get headaches all the time in the office, and I'm like, it's not a tumor.
Again, we as I mentioned, only 30 out of 100,000 is the incidence, and all of those 100,000 people have had headaches, and some of them have had chronic headaches. The one thing I would say to watch for is a change in headache pattern. If you're a chronic migraine person and you have a change in the pattern of your headache, that's something different. If you are not a headache person and suddenly you're having headaches on a regular basis, that's something.
Yes.
That's something to watch.
And those are kind of things. I'm gonna just piggyback on that. Those are the kind of times when I want people to come and see me, so we can have that conversation. And then I may want to order some neuroimaging, maybe starting out with a CT scan plus or minus MRI, and then go from there. But yes, those kind of things. Yes, we want you to come in and be seen.
But the headache did not cause the brain tumor.
Exactly. Thank you. Here we go. Statement: myth or fact? Here we go, Dr. Schueler. People working in high radiation environments eventually get brain cancer.
That's the myth. I mean, yes, if you had specific treatment with radiation in your brain, but otherwise not. Can radiation cause brain tumors? Yes, but even in high radiation, you're not usually getting enough radiation in your brain to get it. I use a C-arm all the time, which is a fluoroscopy, which we use radiation. The incidence of us getting brain tumors is extremely low. It's the same as the regular population. So.
Excellent, thank you. Here we go, Dr. Broderick, here we go. Statement: brain tumors can have lasting and life-altering physical, cognitive, and psychological impacts on a patient's life. Myth or fact?
That is a fact.
Please explain.
Well, this is a tumor of the brain. The brain controls everything in our bodies, and depending upon where the tumor is and what it's pressing on and what it has damaged, it can cause long-term physiologic effects: weakness, numbness, tingling, changes in the vision, cognitive effects, thinking, organizing your life, and then also psychological effects, and effects on the family, effects on caregivers, and any time that a person is not able to do what they used to be able to do, that's a very humbling thing for a patient, and it certainly is life-altering.
Yeah. I remember on my recovery when I had my resection, or removal as I tell my wife, because I can't use the word resection in the house because it's too much of a medical word. But when I had my tumor removed, I was just floored. I mean, 6 weeks. They told me to take 3 months off from working. Now, doctors are the worst patients. You guys will hear me say that all the time. And so I took 6 weeks off. And then I was itching. I had the worst case of cabin fever. And I was like, I had to get back and see some people. And so, but even like those first couple of weeks off, you could barely even move. And then my wife would check in on me, and she'd call me from work and be like, "Did you leave the house today?" And I'd be like, "No." And then I totally have my fingers crossed because I went outside for a walk when I wasn't supposed to. But she knows that. She knows I said that before, so it's all good. All right, I know it's the neighbors. I know they ratted me out. All right, here we go. A couple more of these things. Here we go, Dr. Schueler. Here we go. I like this one. Sleeping with a cell phone next to your head can cause brain tumor formation.
No, that's been disproven already.
So when I
Cell
sleep at
phones
night,
don't cause a tumor.
all right, thank you. So when I sleep at night with my phone on my nightstand, I'm all good.
I do the same thing.
Okay.
Yes, me
I do it
too.
because I'm on call, but
Okay, fair enough. So
Necessary part of the job.
thank you for setting the record straight. I agree. That is an absolute myth. All right, here we go. Dr. Broderick, here's a statement. Once treated, brain tumors do not recur.
Oh, wow, I wish that wasn't a myth.
I agree, I wish
but
that
it
wasn't
is.
a myth.
That is a myth. Unfortunately, frequently, especially the malignant brain tumors, they tend to grow back. And even some of the benign tumors, once they've been resected, they've been removed, sorry.
Yes,
Sorry,
Tiffany.
Tiffany.
Yeah, she's good with that one.
Once it's been removed, still has the potential for growing back. So it's very important to continue your follow-up with your, whether it's your medical oncologist, your neurosurgeon, neurologist, primary care doctor, whoever is following your tumor going forward. You need to maintain contact, and you need to be getting your scans when you're told to get your scans and things along those lines.
Yeah.
Because when they do come back, there are more treatments available.
Yeah. I just been recently graduated, now 8.5 years out from my procedure, but recently graduated that I can take a back seat on some further imaging. But
Excellent.
but I think like part of me's like, what if I just maybe just do one more MRI? 'Cause I just love getting MRIs done.
I'm sure
Love
you
them. Again, a Valium will help out,
Right,
and so that's
But
pretty good.
But it does,
Yeah.
but you get that.
Yeah, you get that hot feeling. I know.
You know, and that's important too.
Let's do one more of these. Here we go. Dr. Schueler, I like this one. Brain tumors affect women, men, and children of all races and ethnicities.
yes, they do.
All right.
That's fact.
All right, thank you.
There's-
Please explain.
Well, they hit everybody, and even though meningiomas are more common in women than men, they still hit men. So
Yeah.
it doesn't, like I said earlier, it doesn't discriminate. It hits everybody. It gets kids, it gets adults, it gets older, older population as well. Some tumors have come later in life and some earlier in life, but it doesn't discriminate.
All right, thank you very much. There you go, guys. Myth versus facts, brain tumors. So we got about 5 minutes left.